Hello, my name is Sian and welcome to Shift with Sian, the condition series, where I break down medical conditions in a way that's clear, practical and straight to the point. In each video, we'll cover what the condition is, how it's diagnosed, the risk factors, treatment options and what the current gold standard and national guidelines are. We're also going to look at what the patient and the nursing considerations are that you need to know. So whether you're a nursing student, a healthcare professional, or you're just curious to know more about the condition, this is your quick, reliable refresher. Let's get started. This week, we're looking at sepsis. I have created a sepsis pack for you to download for free to keep in your pocket at placement. Keep watching to find out where you can download your free sepsis pocket pack from. Sepsis is a medical emergency that claims more lives annually than breast, bowel and lung cancer combined, yet it's often preventable with timely recognition and treatment. In this video, we're going to delve into the definition, the pathophysiology, the symptoms, treatment protocols and best practice for managing sepsis, with a focus on UK guidelines and the nursing considerations. So what is sepsis? Sepsis is the body's extreme response to an infection. A common definition of sepsis is a dysregulated immune response to infection that can lead to organ failure. So instead of the body just fighting the infection, it triggers a systematic, so a whole body inflammation response that can damage organs and tissues. This can rapidly lead to septic shock. So this is sepsis with persistent hypertension, so low blood pressure, that can't be corrected with fluid resuscitation, so pushing the IV fluids. Multi-organ failure and even death if left untreated. It's sometimes referred to as blood poisoning, but that's not entirely accurate. The pathophysiology then. So when a pathogen enters the body, the immune system releases cytokines and inflammatory mediators to fight the infection. That's a normal response. In sepsis, this response becomes uncontrolled and widespread. So your blood vessels dilate, which lowers your blood pressure. Your capillary permeability increases, so you get leaky vessels. Microclots can then form, further impairing the circulation. All this reduces your body's ability to get oxygen to those tissues. The heart may initially compensate by increasing the heart rate and its contractibility, but it will fatigue. The organs like kidneys, liver and lungs would then also start to fail. Understanding this cascade helps explain why the early signs can be subtle but then progress rapidly. The symptoms of sepsis. So symptoms present differently in adults, children and the elderly, but there are some common signs and these include fever or hypothermia, so the extremes of temperatures, tachycardia, so fast heart rate, tachypnea, which is your increased respiratory rate, hypotension, which is a low blood pressure, confused or altered state of mind, a reduced urine output and a cold, clammy or mottled skin. And this is due to the reduction in blood pressure and the oxygen getting to those peripheral limbs. It's also important to highlight the UK guidance for red flag symptoms of sepsis include persistent hypotension, low blood pressure, a lactate of more than 2 millimoles shown on a blood gas result, and organ dysfunction. Compare a patient's baseline vital observations to now. So use your News 2 chart, or if it's in a digital form, as subtle changes can indicate early sepsis. Sepsis risk factors. Sepsis can happen to anyone, but there are factors that increase the risk of sepsis. Things like extremes of ages, so less than 1 year old and over 75. Impaired immunity, so those receiving chemotherapy. Have impaired immune function, like in diabetes, have a splenectomy, or sickle cell disease. Those taking long-term steroids or immunosuppressants. Patients who have had surgery or invasive procedures in the last 6 weeks. Any breach of skin integrity, so cuts, blisters, burns, skin infections. Patients who misuse IV drugs. Pregnancy or less than 6 weeks postpartum. And indwelling devices like catheters or cannulas. If you think sepsis for every patient, no matter their risk, you won't overlook even the smallest signs. So the causes and common infections that lead to sepsis. So urinary tract infections, especially in older adults, this is called urosepsis. Pneumonia, so chest infections. Abdominal infections, such as appendicitis. And skin or wound infections. Immunocompromised patients are particularly vulnerable for this. The treatment and management of sepsis. So early recognition is crucial. Remember the mantra, sepsis is an emergency. Management in the UK follows a UK Sepsis Trust guidance. This includes initiating the Sepsis 6 bundle. This is give high flow oxygen, take blood cultures, administer IV antibiotics, start IV with fluid resuscitation, measure lactate, and monitor urine output. So let's go through each of these and see where the nursing considerations are. Oxygen will need to be given to maintain saturations above 94% unless it's contraindicated. Blood cultures need to be taken ideally before IV antibiotics administration. Make sure antibiotics are prescribed and administered quickly. You don't have to wait for the blood results to come back. Get IV fluid prescribed and document input and output on a fluid balance chart. A VBG, so a venous blood gas, is the quickest way to get a lactate reading. A high lactate is a non-specific indicator of metabolic stress and hypofusion, and it's a marker of severe illness. The higher the lactate, the higher the chance of mortality. Remember, anything more than 2 millimoles is not good. Measure urine output may include catheterisation and using an hourly catheter bag. Other investigations that you can do as a student nurse or a healthcare professional is to take wound swabs, get a chest x-ray ordered, or do urinalysis to help to identify where the source could be. The golden hour. So these 6 interventions should ideally be started within the first hour of recognition of sepsis. This is known as the golden hour. This is because studies have shown that those treated with antibiotics within the hour are a third more likely to survive than those treated after the hour. Now, NICE guidelines, the links in the bio, states that patients with suspected sepsis with one or more of those red flag symptoms should be treated with a broad spectrum antibiotic given IV within an hour. Now, broad spectrum meaning an antibiotic that's effective on a wide range of bacteria. Specific antibiotics will be based on the patient's age, sensitivities, and likely source of infection, as well as the local guidelines. Get onto your trust internet and read through the sepsis policy, as each trust will be slightly different, but they will all follow the NICE guidance. Patient considerations. Now, sepsis is scary for us, so imagine how it's going to be for the patient. Many patients describe thinking, I thought I was going to die. That level of fear stays with them long after the recovery. And it's not just the physical symptoms, it's the panic, it's a sense of impending doom, it's the feeling of being trapped inside a failing body. As nurses, we can't underestimate the emotional trauma of that. Be honest with your patient, explain that the team are treating for sepsis, and lay out the treatment plan and how you're going to monitor it. Reassure the patient that we're starting treatment and that should start to feel better soon. So UK guidelines and best practice follow the NICE guidance for sepsis. So sepsis screening for all patients with a suspected infection. Use the NEWS2 scores for escalation of care. You follow the Sepsis 6 within the 1 hour of recognition. Document all interventions and patient responses. Always refer to the latest NHS resources and local trust policies. Remember, early recognition saves lives. Observe vital signs for subtle changes. Understand the pathophysiology. Practice your communication with patients and mentors. Learn the escalation pathways and always ask questions. Familiarise yourself with the sepsis team in your trust. They usually will have an extension number for you to call. Confidence comes with practice, and sepsis is a condition where every second counts. Thanks for watching my condition series on sepsis. Now hit subscribe and follow Shift with Sean for more nursing condition breakdowns, tips and real world advice from a nurse who's out there with you. Let me know in the comments what conditions that you'd like me to cover next. You can download your free sepsis pocket pack to take with you in placement on my website www.shiftwithshawn.co.uk. Click free resources. The link for that is in the bio. Be kind to yourself. We've got this.